Hello and welcome everyone to this episode of the American Academy of Optometry Foundation's clinical podcast series. Today we're going to be discussing an interesting article titled Analysis of Association of Bandage Contact Lens with Serious Vision-Threatening Disease and Their Management with the wonderful Marsha Malooley. I'm your host. I'm Andrew Pucker. I'm a fellow and diplomate of the Academy. And today, as I said, we have with us Marsha. Marsha, could you please tell us a little bit about yourself?
Thank you so much, Andrew, for having me. I am also a diplomate in the American Academy of Optometry in the CCLRT section. I currently work at a ophthalmology office called Chicago Cornea Consultants, and I've been there for just over 20 years. And I do a lot with perioperative management as well as, corneal disease and specialty contact lenses, which is why I thought this was a great article. And then I work with students as well who come through the clinic and residents on Tuesdays. I completed my residency at the Illinois College of Optometry and then graduated from NECO. So it's nice to be able to talk about, something that I deal with on a regular basis in clinic.
That's awesome. Yeah, you sound like the expert for this paper. So bandage contact lenses are really important in clinical care. So maybe you could give us a little background on when you would use these lenses, what type of lenses we would use, that sort of thing for our audience.
So we use them quite a bit in perioperative care with our different procedures that we do. So commonly we will use bandage lenses after our DMEC procedures, especially if there's a lot of microcystic edema after the procedure to keep the patient comfortable. After our LASIK enhancements, we'll use bandage lenses, patients who have superficial keratectomies, PRK. So we're using bandage lenses quite a bit post-surgical, but also in treating specific conditions. Recently, I had a patient we had to do a bandage lens for. They had a suture tract leak and were Sidel positive after their penetrating keratoplasty. And we pressure patched them and eventually just did a bandage lens to have that seal up. And then also patients who have band keratopathy and have problems with epithelial breakdown or non-healing epithelial defects. So really just to try and rehabilitate the cornea in certain conditions.
So kind of with that, is there any specific characteristic of the soft lens that you would want to use in these patients, like Sci-Hi, hydrogel? Does that matter? Diameter?
Studies show that hydrogel contact lenses do not do as well as silicone hydrogel lenses with healing the cornea. So we use silicone hydrogel lenses, and a lot of times these patients are sleeping in the lenses for extended periods of time. So we use Sci-Hi lenses that are approved for overnight wear and bandage lens use. And depending on how long we anticipate the patient having that lens on, we might select a lens that, would be appropriate for a week or something that may be appropriate for closer to a month. And then also I look at, in terms of fitting the contact lens, what type of cornea I'm putting it on. So if it's a oblate cornea, maybe like that, penetrating graft, if it's more of an oblate graft, or if it's someone who's had refractive surgery, I might select a different curve of lens versus another just to get that lens to fit well.
So I think that all makes sense. One thing that I've always worried about with bandage lenses is that you're putting it on a sick eye. So is there additional risks that might come with putting a contact lens on a sick eye that might already be more susceptible to, say, a bacterial infection or something like that?
Yeah, absolutely. So prophylactic antibiotics are really important when using bandage contact lenses, especially on these eyes. So we always have them on a prophylactic antibiotic. I also highly recommend artificial tears to the patient because I think keeping the lens lubricated is very helpful as well. And if the patient is really of concern in terms of a much higher risk, then we'll see them back to evaluate and monitor just to make sure that we don't see any initial complications when bandage contact lens use is first initiated, especially if it's a patient who maybe has reduced visual acuity and can't really tell if their vision starts to degrade, or if they have like a neurotropic cornea where they're not going to sense that something is wrong and they don't have that pain response. So we'll watch them a little more carefully.
I love that advice. So let's kind of turn to the focus of our paper. So we have this study that looked at over 600 patients over 10 years. What can we gain from this study related to bandage lenses?
I think the main point of this study was looking at the safety profile of using bandage contact lenses, and they were looking at adverse events. They really looked at three key points to qualify as an adverse event. They looked at loss of visual acuity of more than 2 lines. They looked at endophthalmitis, and then they looked at someone who then needed a penetrating keratoplasty or a corneal graft. And the key point was that they found there really wasn't any adverse events associated with bandage lens wear that they could account to the contact lens. So there were 2 potential adverse events, but they could not directly link it to the contact lens. And these were corneas, again, that were sick anyway, and they were episodes of endophthalmitis. So they couldn't say that it was exactly due to the contact lens, but out of 600 and some patients to just have 2, I think that shows a very good safety profile.
I totally agree. And that does make me feel better. So one thing that I thought was interesting is that they looked at only the first 100 days after starting the lenses. So does that matter? Are you worried about a adverse event that pops up after 100 days on a bandage lens? You think that's related at all?
Well, rarely do you have to use a bandage lens for more than 100 days. I do have some patients who wear bandage lenses on a regular basis, maybe for band keratopathy or other things, but if they successfully wear that contact lens for, say, the duration of the study, 100 days, I think the chance of having a complication due to that lens, it would have shown itself by then. So I think the chance of having a complication after that time frame is very low. But in clinic, most of the patients that we're going to be using these lenses on, they would not fall outside of that 100-day period of time.
Yeah, and you're probably monitoring these people really closely anyway. So if there's something going to go on, you're going to catch it early, I would think.
Yeah. And a lot of times the bandage lenses are being used for like pain management purposes or healing purposes. Our lid has shearing forces that go over our epithelial surface. So with the bandage lens being able to improve epithelial cell migration and then also make our patients more comfortable as that cornea is healing, the cornea is amazing in the fact that it heals quite quickly. So in a lot of cases, that lens isn't necessary for an extended period of time.
Oh, well, we've talked a lot. We've talked about a lot of things. Are there any other closing thoughts you want to leave with our listeners?
I think that bandage lenses are great. I would encourage everyone to use prophylactic antibiotics when they are using bandage lenses on their patients. I think that it's important to be selective on who you're going to put a bandage lens on. I tell my students and residents that they should avoid using a bandage lens to treat someone who maybe had a corneal abrasion due to vegetative matter, or when you're more suspicious that a infection could be brewing. But I also think that it's important to not be afraid to use them in clinic because there's a lot of different benefits and they can really help our patients.
Perfect. And I'd like to thank you all for tuning in. I could ask you to do a couple things, like and subscribe, and then I hope to see you again on another episode soon. Thank you.
Thanks.